Hello and welcome to our video on how to perform an Amsler test through Telehealth. What is Amsler? Amsler tests are used in suspected macular pathology. The central 10 degrees of the retina is assessed by 1 degree per box. It can easily be performed in person or over digital telehealth. It can be used by the patient to monitor their condition at home. Indications for the use of Amsler: age-related macular degeneration, central serous retinopathy, vitreoretinal diseases, cystoid macular edema, non-arteritic anterior ischemic optic neuropathy, pituitary tumors, and drug-induced retinopathy. What is telehealth? It is using communication technology such as Zoom or apps to deliver reliable healthcare. Telehealth can include monitoring patients or education. Telehealth can eliminate barriers such as distance and time. The aims of telehealth include improvement of patient outcomes, increased efficacy, and maintaining all relevant standards and quality in delivery. Advantages to combining both. Amsler Grid is electronically available. It eliminates patient travel time and distance, lowers the risk of COVID-19 in the clinic, is quick and easy to explain and perform, helpful for documenting progression. Patient monitoring is sustainable away from clinic, and minimal equipment is required. Some disadvantages to combining both. It's not as accurate as face-to-face, may be difficult to monitor the patient, internet accessibility, patient must be technologically aware, patients with hearing loss may present challenges, language barriers, and informed choice and consent. Patient setup. Ensure that the patient has received and printed the grid on an A4 paper to scale, that they are familiar with the technology. They require a pen, paper, and eye patch. The patient wears their reading glasses. They hold the Amsler grid 33 centimeters away in reading position. The room lighting must have good illumination. They are to cover one eye completely with an eye patch or hand. On the paper, include their patient details. And if a patient has pre-existing AMD, place a cross through the center of the chart for foveal fixation. Amsler instructions. Ask the patient to look at the center dot and keep focus on it at all times. Do any of the lines appear wavy, blurry, or distorted? Are the vertical lines straight? Are the horizontal lines straight? Are there any holes or dark areas on the grid? And can you see all 4 corners and sides of the grid? Now we will watch the student orthoptist perform this test over telehealth.
Hi Ramya, I'm Ryan and I'll be your student orthoptist for today.
Hi Ryan.
Thank you for coming along to the telehealth session today. Really appreciate that. So I've been told you're a little bit concerned about your family history of macular degeneration.
Yes, I'm concerned.
That's okay. We'll be performing a test just to help monitor any signs of macular change. We call it the Amsler test, okay? And I understand that you currently don't wear any reading glasses.
No, I don't wear any glasses.
Wonderful. And have you printed the 2 copies of the grid that I sent you earlier this week?
Yep, I did. I got 2 of them.
Very good. And also, I just advise you if you could possibly buy an eye patch. Has that been done?
Yep, I got this one.
Awesome. Well done. That's all we need for this test. So now that we have everything, I'll just explain the instructions to you. It's quite simple, okay? So the test relies on you to hold the paper at about 33 centimeters at reading position. Can you just move to the side and just show me how you would do that? Yeah, wonderful. Awesome. So now before we begin, I'll just get you to put the eye patch in front of your left eye.
Yeah, shall do that.
Wonderful. Well, I'm just going to give you a series of instructions, and I just want you to say yes or no if you see any of the following, okay? So holding that piece of paper in 33 centimeters in reading position and looking at the black dot for me. Now, while looking at the center dot, do all the lines appear straight or do some appear wavy, blurred, or distorted?
Yes, all are clear. There is no wavy or wavy lines.
Wonderful. Now, while looking at the center dot, do all the boxes appear square and the same size?
Yep, all are square and same size.
Wonderful. And all the vertical lines straight?
Yep, they are straight.
All the horizontal lines straight?
Yep, they are straight.
Wonderful. While looking at the center dot, are there any holes or missing areas within the grid?
No, I can't see any holes or missing areas.
Wonderful. And while looking at the center dot, do you see all four corners of the grid without moving your eyes?
Yes, I can appreciate all four corners.
Wonderful. So now we'll just change the eye patch over to the next eye and just again holding that piece of paper in reading position for me, okay?
Yeah.
Wonderful. You've got your pen?
Yep, I got my pen.
Very good. So while looking at the center dot, do any of the lines appear wavy, blurred, or distorted?
I can see some wavy and blurred lines on left-hand corner of the grid.
Yeah, can you just draw them in for me?
Yep, sure. Yeah.
While looking at the center dot, do all the boxes look square and the same size?
It's the same size, just apart from the left-hand corner where it's uneven.
Yep. And are the vertical lines straight?
They are wavy on the left-hand corner.
And what about the horizontal ones?
They are also wavy on the left-hand corner.
What about the rest of the grid?
The rest of the grid is all straight.
Yep, make sure you stay fixated for me. While looking at the center dot, are there any holes or dark areas on the grid?
There are no holes or dark areas in the grid.
And while looking at the center dot, can you see all four corners of the grid?
I can see all three corners. The left-hand corner is not that clear.
Okay. Do you mind just shading in that area for me?
Yeah.
Awesome. Thank you for doing that. So that's all done. So you can take the eye patch off. And just before we conclude today, I just want you to write your name, your date of birth, the date, the time, if you wore glasses during the test,
Yeah.
on the piece of paper, okay?
Yep, shall do that.
And if possible, I'll get you to send me a photo or a photocopy of that piece of paper, just so I have a copy as well, okay?
Yeah, sure. I'll send that.
Now, just a little bit of a task for you. Just to keep the grid printed at all times and stuck on the fridge, just so you can complete the grid at least once weekly, just so we can monitor any change going forward, okay?
Yeah, shall do that.
If you monitor any change, just let us know and bring the grid along with you, so that way we can discuss the results.
Yeah, I definitely shall do it, Ryan. Thank you.
No worries. Thank you, Rama.
What it all means. Missing areas or shaded areas can appear anywhere on the chart and indicate scotomas, and wavy lines also indicate metamorphopsia. Thank you for watching our presentation on how to perform an Amsler test through telehealth. We hope you enjoyed our video.